All right. So, good morning, everyone, and welcome to the first session for your Certified Medical Administrative Assistant training. My name is Dr. Lisa Campbell, and I will be your trainer for the next few weeks. So, I wanted to start off by really setting the stage for how we're going to operate over the next few weeks. One of the things that you will find about me is that I do believe in structure and order. So every day, unless there is an act of God, I will be starting class on time, 9 o'clock Central Time. So if for some reason you arrive late, that's fine because remember, the sessions are going to be recorded. And so you can go back and play whatever part that you missed, because things happen. I know that many of you are still homeschooling and all that good stuff. And I'm happy to say that we have no little children. So uh, we are done with that part of our lives. And we don't have any grandchildren right now. And we're not ready for those either. We want our kids to really just enjoy life, figure out what life looks like. As my daughter says, she don't like adulting. She don't like being an adult, but she got to get over it because my husband has a rule of 18 and out. So once you turn 18, you got to move and you got to figure out life. So um, I want to share a little bit with you about my background. And then I'm also going to have you share about your background. So you're going to also find that I'm going to be using a timer because I want to make sure that I stay on track, that you stay on track. So we probably will take about 30 minutes with me introducing myself, you introducing yourself. You will find that I'll be taking notes because I want to be able to, months from now, remember you. Oftentimes people will email me and say, don't you remember me? And I'm like, no, not really. So if I take notes, it's a little easier. So a little bit about my background. I started in healthcare in 1992, and I started off as a medical assistant. The reason I went to school for medical assisting is because I had a baby, my one and only baby. I got one biological daughter and three stepchildren, but I had a baby. And at the time, I was working as a manager at McDonald's. And back then, I think I was making about $3.90 an hour. That was minimum wage when I first started was $3.35 an hour. But I think I had got some promotions and I was making about $3.90 an hour. And I had this baby and I realized that Pampers and milk and all of that was kind of expensive. Even with WIC, public assistance, I found that I was not able to make it. And my mom, once I had my baby, after about 3 months, she was like, two grown women cannot live in this house. And she's like, you got to move. So that was that was a very difficult thing to hear because number one, I didn't know how to be a mother because kids don't come with a handbook or instructions. And then at the same token, or at the same time, I had learned that my daughter was deaf. Um, the doctor said that she was not going to be able to walk. So today, 28 years later, almost 29 years, she does not hear, she does not talk, but she definitely can walk and she can eat. and she can express herself just like the rest of us. So while working as a medical assistant, one of the things that I really realized was I did not want to be a medical assistant. I did not like, do not like dealing with patients. I don't care what hurt, how long it's been hurting, why you didn't take your medication when I told you to bring your medications in. You don't know which ones you were taking. And so I went to medical assisting school because I come from a family of nurses, but also I needed to buy those Pampers, right? So while working in the office, I was forced to do medical coding, medical billing, medical records, basically anything that you had to do in the office, I was forced to do it because that's what, my job entailed. And I was not a certified medical administrative assistant. I was a certified medical assistant, CMA. And so a CMA, we were required to do administrative and clinical work. But I figured out I do not like the clinical side. And I didn't want to work with patients. So over the years, while working as a medical assistant, 5 years exactly, I was like, my boss, she really don't know what she's doing. And I need to be in charge of this office because I was like, I know more than her. And she got the job because she knew someone, but she didn't know a whole lot of things. So she basically was a dictator. And if she wasn't in the office on a particular day, people will always come to me and ask me, well, how do you do this and all of that? And there was a lot of things that I knew that she didn't know how to do. So from there, after realizing, I want to be in charge, I went to the HR department and I said, I need to be in charge. I want to be an office manager. And they said, well, you need a degree. And I said, well, my boss don't have a degree. Why I need a degree? Well, my boss was Caucasian and I was African American. And they told me I needed a degree. And from that point forward in my life, I said that I would never, ever, ever, ever be in a position where someone could tell me that I was not qualified for anything. So I got my bachelor's degree in healthcare administration. I finished that in 1998. And from there, I'm like, medical assistant, you can kick rocks. I'm done with you because I didn't like it. But it was a good start because I learned about everything related to the office. I learned about it. So from there, I went to, number one, I started teaching because I realized that I did enjoy teaching others. And so I started teaching in 1997 and finished my bachelor's degree in 1998. And then started working at Cook County Hospital. And I got a position as a director, had no experience being a director. I just, had this bachelor's degree. And at the time that I applied, I was also working on my first master's degree in healthcare administration. And so I started I got the job at Cook County. I asked my boss, I'm like, why did you hire? Oh, Jasmine got $100. I need $100, Jasmine, today. I asked my boss, I said, why did you hire me? Because all these other people had experience. And, why me? he said, well, I figure if you could manage people at McDonald's, you could manage people here. I didn't know what he meant by that because everybody that worked at the county that I was responsible for, besides the physicians, they were in a union. They did whatever they wanted to do. If I tried to get them to do something different, they didn't want to do it. They was mean. They didn't want to learn anything new. And needless to say, I realized that I did not want to be a manager anymore. I did not want to be in charge of people because I really felt like I was like babysitting people. And I don't like babysitting people. I am not someone who likes to hold somebody's hand. But I do like to educate people. But I'm not going to hold their hand and walk them down the street. And that's literally what I had to do when I worked there. So today, where am I? So of course, I don't know. I realized that there was power in education. And so I continued going to school. I was teaching at one of the universities and or colleges, South Suburban College to be exact. And I said to the HR department, again, I'm always going to the HR department. I said, how can I make more money at this joint? Because I'm like, I'm not making enough money. And I'm like working day and night. And they were like, you got to get a doctorate degree. I'm like, what? You mean this master's degree is not enough? And so again, mind you, I developed this mindset that you are not going to tell me no, I can't get something, right? And even today, you cannot tell me no. It's okay if it's like not right now, but no is not an option for me. Probably drives my husband crazy because he's like the wait and see type person, and I'm the action person. If I set a goal, I am in execution mode day and night, right? So like right now, I'm in execution mode to get rid of my COVID weight. All that weight I gained last year by putting any and everything in my mouth. I'm on a mission to get it off. So anyway, I did earn that doctorate degree. My doctorate degree is in healthcare administration because other than McDonald's, that's all I know. And then about 5 years ago, I was just doing some research about where are the jobs, where are the opportunities, and I learned that project management was an area that had lots of opportunities for growth because as a project manager, you are essentially working on a project. It's a temporary situation. It has an end date. And I am a project-oriented person. I like to work on something and then see it through to the end and then be done. So for example, this class is essentially a project. Why? Because I'm popping in for a few weeks, and my goal, I have several goals for you, but one of them is that you can become a certified medical administrative assistant, but also have more than that. I want you to walk away with just more than just that certification. So you heard me mention that I was literally forced in the doctor's office to do medical records. Back then we had paper medical records. So I was forced to do medical records. I was forced to do medical coding. I was forced to do medical billing. And medical billing, back then, we were typing up claim forms on a typewriter. Some of you are probably too young, don't even know what a typewriter is. Google it. But I had to type up claims on the typewriter. So over the years, I learned that there were different certifications for individuals who do medical coding and medical billing. And I'm going to share with them what they are. as a healthcare professional, I also belong to several professional organizations. And the professional organizations that I belong to, they have certification exams that you can take. So don't get alarmed. Don't think like, oh my God, she has to be like super crazy. But I currently hold 10 national certifications. So the first agency that I belong to is the American Health Information Management Association. And from that particular agency, which is based in Chicago, Illinois, I earned the Registered Health Information Administrator certification, which that certification requires that you have a bachelor's degree in healthcare administration. I'm also certified as a clinical documentation improvement practitioner. I'm also certified through this particular agency in medical coding, both coding for the physician as well as coding for the hospital. I am also a member of the American Academy of Professional Coders, and through that agency, I earned certifications in billing, coding, auditing, as well as a instructor certification. Lastly, what do I do today? I am president and CEO of Physician Practice Resources Incorporated. We are based in Matson, Illinois, and the services that we provide primarily to physician practices are medical coding, revenue cycle management, which is also known as medical billing. We provide clinical documentation improvement services. We provide training to providers and staff. So for example, there was this big change that took place January 1st as it relates to how physicians capture their office visits. And so I spent the month of December training providers. And then we also provide some practice management solutions. So why did I tell you all of that? Because number one, I want you to get to know me, and I also want to get to know you. But also, you're going to be looking at job ads. You're going to see different credentials listed in job ads. And I want you to know what those job ads are and what they mean, and know somebody who actually has them. All right, so enough about me. I want to take some time to get to know each and every one of you. And I'm going to be taking notes just because, again, I need to be able to remember, because when we get off of here, I got back-to-back meetings. And so I'm going to forget who you are and what you do. And so I want to learn a little bit about each of you. And I'm going to start with the richest person in the room. She got $100. I don't got $100. And also because my daughter, her name is Jasmine. So the name Jasmine has a special place in my heart.
Okay, hi, I'm Jasmine. I'm 24 years old. I have two small children. I originally would love to be a mortician. However, it's been a lot of family issues going on that I feel like I could be a help going in the healthcare field. I know I don't want to be like hands on with like a CNA or anything. Like I don't want to do anything like that. So I know I'm a good office person. Like I'm a people's person rather. I feel like I could do the office field. That's what made me come to this class. I also had a friend that previously went to the class. She just graduated from you all's last class. So she actually told me about this class. So yeah.
All right. Thank you, Miss Jasmine. Next, let's see. Mr. Walter Ward, who I had to rename your name. Do I need to unmute you? Oh, you got that part. All right, Mr. Ward.
Ha 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 ha! You're funny. How you doing, Dr. Campbell?
And amazing.
Good. My name is Walter Ward. I'll be 64 in April. Uh,
April, me too.
what day? Are you in the back half or front half of Taurus, or you?
I kick off the month. I'm April 1st.
Okay. Well, anyway, I learned about the class through Brother Pugh and another sister that just graduated. So I've been retired from Chicago Public Schools for some time now. So I just want to get into doing something else. You know, I want to start off maybe in the office and then work from home, because with this COVID thing, everybody's working from home. I don't want to step on any young person's toes that really needs a job, but it's just something for me to do, some extra money to make in the process. So
All
thank
right.
you, and from what I see, I'm gonna get a lot out of you.
More than you probably want.
Yeah, well, that comes with the territory.
All right. Thank you so much. Next
You're
up,
welcome.
Miss Nancy Gutierrez.
Hello, good morning, everyone. Good morning, Dr. Campbell. My name is Nancy Gutierrez, and I'm a mother of one girl. I'm currently homeschooling right now, so I have to balance that. um, and what interested me in taking this class is because I do like the office side of things, and I think starting in a medical office would be a good start for me. So, yeah, that's why I'm here.
Sounds good. Sounds good. Thank you. Let's see. Dejanay Garner. Hopefully, I'm saying you guys' names right.
Hello, good morning. My name is Dajane Garner. Um, I chose to take this class because it's giving me a step towards being in the medical field, because I want to be a pediatric nurse.
You went on mute. I heard pediatric nurse, and then that was it.
Um, um, I feel like this class I can learn a lot to help me when I become a nurse in the future. That's it.
All right. Thank you. Next up, um, ooh, I'm just gonna say Miss Latasha.
Good morning.
Good morning.
My name is Latasha Polis. I have two daughters. I always wanted to work in the medical field. And when I heard about this class, I said, let me go on and take it so I can, that's a step in the medical field. That's why I joined.
All right. Thank you. Next up, Fuller. I could just see fingers. All right, there you go.
Good morning. My name is Arnedia Fuller. I am 49 years old. I have four kids, three grandchildren. Um, I have I have a licensed home provider, daycare, and I just got in this field, took this class just to get something else under my belt.
All right,
Thank
thank
you.
you. Let's see. Coleman, Miss Chastity Coleman.
Hi, I'm Chastity. I'm 19. I'm in college. I don't have any kids, but I do have a baby sister. She might pop in and out of class sometimes. I don't know if you've seen her. And I've done this. I've kind of already been a CMAA without the certification. We worked under a doctor. We were like playing around since she's trying to start her own business. So we've done that. I don't know if you've heard of simple practice, but it's a way to like do like telehealth and talk to her patients. She's a therapist. So I've done her billing, invoices, insurance, everything. So yeah, and I do like the customer service realm, so I'm kind of here.
All right, you've done a lot for 19 years of age.
Yeah.
All right, and let's see. Hillard. Tanya Hillard. I don't want to mispronounce you guys' names.
It's Tanaya.
Tanaya. Okay, I'm going to get it right by week 2.
My name is Tanaya Hillard. I'm 20. I always wanted to work in the medical field. I want to be an RN. So I felt like this was giving me a step closer to where I want to be. Plus, my mom graduated from this program, so that's why I joined.
All right, so a lot of people who either heard about the program from somebody else or you're trying to do something to supplement your income, or I don't know, some of you may just be passing by because the pandemic has caused all of us to rethink what we're doing. But hopefully you have seen that healthcare is somewhat of a stable profession. And the reason why I say somewhat, there are some healthcare professionals during this pandemic that were furloughed based on what type of job they provide, if the organization could not put them in another capacity within the organization. So one of the things that I want you to really, really think about is always thinking about what else you can do to grow. But when you learn a new skill, you want to put that skill to work. You don't want to just, I've seen lots of people who have lots of certificates, and there's a difference between a certificate and a certification. A certificate means that you completed a program, some type of training program. Whereas a certification means that you have taken a national exam. And with national exams, there are generally some requirements that you have to meet in order to keep your national certification. So for example, those certifications that I have to do continuing education annually to keep those certifications. Additionally, those particular organizations require me to pay an annual membership fee. And so when I say that it's important for you to use what you are getting, you don't want to be someone who has a bunch of certificates or certifications and you're not doing anything with them. So for example, those certifications that you saw on the previous slide, I do something with each and every one of them. So even though I'm a business owner, I still do some medical coding because I like to keep my skills sharp. When I teach medical coding, I don't want to be talking about what we used to do. I want to be able to talk about to my students what's happening today. So one of the things that you're going to find is that I'm going to bring a lot of what's happening in the real world into the classroom because that's important. I don't want you to walk away knowing what's in some type of study packet, because what's in the study packet, you need to know for the national exam. But what's in the study packet and what's happening in the real world are two separate things, two separate directions. The basic principles are there, but what we're going to talk about is going to help you think about this from a real world perspective. So, the one thing that I'm going to ask is that during this journey, that you go with me on wings of imagination. And I want you to imagine that you are not the patient. You are the medical administrative assistant. When you come into this space, you are the medical administrative assistant. I want you to be able to think like a medical administrative assistant. I want you to be able to act like a medical administrative assistant. And I want you to grow as a result of this process. As a result of this process, there are going to be some things that you learn that will help your families. For example, and I'm not picking on Mr. Ward, but Mr. Ward said he's retired from CPS. I know you happy about that. Perfect time to be retired from the CPS, because I got a little niece and nephew in CPS, and I would not want to be their teacher, because my little nephew, I just want to punch him every chance I get because he's so bad. And when he's on school, he's supposed to be in school, he done walked away from the computer, taking his own self breaks. So my hat's off to CPS today, because I don't know how they do it. Because I know if I had to deal with my nephew, they had to escort me off of the Google Classroom, because I definitely would be having a little few words with him. But he's a boy, and I know boys are special. So let's talk about my goals for you. I have two goals. Number one, yes, I want you to pass the exam. And as Mr. Pugh stated, we have a very good pass rate when it comes to the exam. The exam is what I like to call the price of admission, the price that you got to pay, the work that you have to put in to be able to qualify for a job. But at the end of the day, that piece of paper is not enough. You still have to be able to actually do the job. And every organization is different. Every organization has different computer systems that they use to carry out their day-to-day work. But you don't want those differences to be a barrier for you. You want to be able to take your skill sets and all the tools that I'm going to give you and take them with you no matter where you land. So if you land at Northwestern Hospital, University of Chicago, St. Bernard, Ingalls, wherever you land, I want you to be able to take everything we're going to talk about, and I want you to be able to speak to it in a job interview. And when you get the job, I want you to be able to put those skills to work. So these are my two goals for you. And I'm a goal-oriented person. And so our task is to go through the motions to get you to this point. The other thing I want you to recognize is CMAA may not be a title that you actually see in a job posting. And that's very important. So as we go through this journey, I'm going to give you buzzwords, if you will, that are in job postings, because when you apply for a job, you got to have a resume. So on your resume, I want your resume to have buzzwords that will allow that potential employer to be able to pull your resume and call you in for an interview. I'll tell you a short story. My daughter, who is 22, the one who doesn't want to be an adult, she is a senior at Southern Illinois University. Her major, I don't know why, is healthcare management. No clue why. My husband says I created a monster, but and she's my stepdaughter, so I don't know how I did that. But anyway, pandemic hit, and she was living in off-campus housing, and she was like, I'm not about to pay rent to go to school online. So she came back home. So you come back home, not here though. You know, we got my husband has that 18 and out policy. So not here. You can come visit, but you can't live here, maybe for a couple of days. But anyway, she had to find a job, right? Because, you know, you got to eat. She got a car note. She got to pay that. So there was an opportunity at Ingalls Hospital to register patients for COVID tests. And she was like, I'm getting a bachelor's degree. I don't want to do that. I said to her, actually, this is your perfect opportunity to get into a healthcare organization so that you can lay that foundation for your career. It's just like there are some people who are physicians who used to clean the toilets, right? So you have to, as a leader, and this is what I explained to her, as a leader, you have to understand what the people who you're leading are doing. So I did, and I kid you not, a 2-hour class with her. And she went on that interview and was able to sell herself to that organization and get that job. So I said that to you to say this. You are the only person that can sell you as a healthcare professional, because remember, you're no longer the patient, and you are on these wings of imagination with me, because you are, from here on out, you are a medical administrative assistant. And your goal is to become a certified medical administrative assistant and get a job. So job titles are going to vary, but I want you to start to learn the terminology. And I don't want you to be a person who learns terminology, but you can't apply it. So for example, someone could say, do you know what Medicare is? And then you would say, oh yeah, that's the insurance for old people, which is so bogus to say that because we're all going to be old one day. But you should be able to say, oh, Medicare. Yes, Medicare is a federally funded program for individuals who are either 65 years or older, who have end-stage renal disease or other disabilities like railroad workers can have Medicare. And Medicare has 4 parts. Part A is for hospital insurance. Part B is for physician services. Part C is a combination of Medicare Part A and Medicare Part B. And Medicare Part D is for prescription drugs. That statement shows a potential employer that you know more than just Medicare is for old people, right? So my goal is, from a terminology perspective, and I'm not talking about medical terminology because healthcare has so many terms that you have to be familiar with, but from a terminology perspective, that you can talk about these concepts. So back to Mr. Ward. So Mr. Ward may be, at some point, gonna get Medicare, right? And Medicare has certain requirements. And oftentimes in minority communities, we don't understand the programs such as Medicare. And we allow the friendly salesman to say to us, no, you don't want Medicare Part A and B, which is the traditional Medicare. You want Medicare Part C, because Medicare Part C is going to give you all of these different things. But oftentimes in minority communities, we hear what we're going to get, but we don't hear and we're not told what we're not going to get. For example, my aunt, sales rep, said, you should get Medicare Part C because you can get prescription drug coverage and all of this. Well, prescription drug coverage is something that piqued her interest because prescription drugs are expensive. And so if she can get a program that gives her the drugs, ooh, that's good, right? But what he didn't tell her was Medicare Part C is an HMO. It's a managed care program. And she could no longer go where she wanted to go for her doctor's office visits because she was now assigned a primary care physician. And this primary care physician, who we also like to call the captain of the ship, dictates where she can go. She didn't like that. Second example, my mother. I don't know why. When she signed up for Medicare, she signed up for Medicare Part C. And she said, the man told me that I can get such and such. And I said, Ma, do you know what I do for a living? Yeah, but you so busy and blah, 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 blah. I said, if that man calls you back or requests a meeting, you let me know. Fast forward to last February. He scheduled a meeting with her, wanted to meet at Panera Bread. I said, what does man want to meet with you at Panera Bread for about your Medicare insurance? She was like, well, he wanted to tell me about some new features. And if I switch to this product, I can get this and this. I said, okay, well, tell him I'm coming to the appointment with you at the Panera Bread. Guess who canceled the appointment? You know why? Because he knew that if I accompanied her, he didn't know me from Adam, but if I accompanied her, that conversation was going to be a little different because I was going to ask the questions that she didn't ask. So I challenge you to, as you learn about these concepts, that you help your family and that you help people in your community, because oftentimes we can't move forward in life because we don't have knowledge, and knowledge is power. Knowledge is power. So speaking of knowledge, you are going to take a CMA exam, and the CMA exam has 7, we're going to call them, let me see what the actual name is because I can't remember. I always call them domains, but let's see what they call them. Oh, they call them domains too. All right. So there are 7 domains on the CMAA exam. And these domains reflect what I like to call different parts of the healthcare revenue cycle. 4 parts of the different parts of the healthcare revenue cycle, which I'm going to talk about shortly. So 7 domains. These are the domain names. So the first domain name is scheduling. I got on reverse from what they have in the documentation, which I'm going to give you a copy of something that breaks this out. But the first area is scheduling. And scheduling, you're going to have 18 questions. After scheduling, you're going to have what's known as patient intake. And patient intake, and I got a typo on here, so I'm going to actually correct this. So scheduling, there's 19 questions. Patient intake, there's 18 questions. So I got them flipped. So I'm going to say it again. Scheduling, 19 questions. Patient intake, 18 questions. The third area, office logistics, there are 12 questions. Compliance, 16 questions. Many people don't realize that healthcare is a highly regulated industry. There are lots of rules that we have to comply with in order to be in compliance with the government. If you are receiving, if an organization, for example, is receiving funding from the federal government, there are certain rules that they have to comply with. For example, if the organization is going to hire someone and they receive federal government funds, they are required to do background checks on their employees. And with those background checks, anyone who has been excluded from participating in a federal government program, they can't hire them. And when I say excluded, I'll give you an example. My daughter lives in, my oldest daughter, who will be 29 on March 1st. She lives in a 4-bedroom home with other women who have intellectual disabilities. That's the proper term, intellectual disabilities. We used to say mental retardation, but it's intellectual disability. And one of the staff members was frustrated one day, and she pushed my daughter down and pushed somebody else down. And one of the other staff members saw it and reported it. As a part of their compliance plan, their organizational compliance plan, they had to immediately report this situation to the OIG, the Office of Inspector General. The Office of Inspector General did an investigation, and they found that the person did push my daughter, push someone else. After the investigation was completed, they asked me if I wanted to press charges against the person who pushed somebody down, who can't talk, who can't hear. And of course, you know what I said. Yeah, because you can't just be pushing people down who can't help themselves. She is a person in a vulnerable population. So this person had been a, let's just say, home health aide for terminology purposes for about 30 years. And as a result of that action, she can no longer be a home health aide. Her name is listed on the OIG's website, Office of Inspector General's website, as a person who has been excluded from any federal government program. So she basically cannot work for any organization that receives federal funding. Child support, Medicare, Medicaid, government, she cannot work for those organizations because when they type in her name, she's going to pop up. So, healthcare has a lot of compliance rules. Education is another area. There's 11 questions. You may have to educate the patient, or you may have to educate the doctor. Policies, general office policies and procedures. There are policies like when you answer the phone. This drives me crazy. I hate when I call somewhere and they answer the phone and they say, please, hello, such, such, please hold, and then put me on hold and don't give me an opportunity to say, okay, or something, right? So offices have general policies in place that tell us how we're supposed to operate. And then, so there's 15 of those questions. And then there are 19 medical terms. So as it relates to the medical terms, you had medical terminology. Did you make flashcards? Head nod. Mr. Ward says yes. Okay, so you made flashcards. Continue to flash through those flashcards because you know that old saying, if you don't use it, you lose it. So continue, because you don't know what terms you're going to see on the test, but also keep in mind that this journey is more than just about that one day, that 2-hour period for that exam. You want to know those terms so when you go to work your job, whether it's like Mr. Ward wants to work from home, or you're going to be working on site. And one of the things that this pandemic has done for us, it has changed how employers think about remote work. Because previously, some healthcare organizations, it was like taboo for them to let their staff work from home. And the pandemic has forced them to work from home, let their staff work from home, but they weren't ready to work from home. So if you desire to work from home, there are some things that you need to have set up to be a remote employee. And if we have time, we'll talk about some things that you need to have in place that it's not written in a book. It's just some things that you need to have in place if you want to work from home. All right, so we've been at this for about an hour. I do want to take a 10-minute break because I don't know about you, but I have to go to the bathroom every hour. So, because I'm drinking a lot of water. And my bladder is a little older and I'm going through menopause. Too much information, but I have to go to the bathroom every hour. So, but I'm only 24. So before we take, that's right, Mr. Ward, I'm 24. And my grandfather just turned 100. You probably, if you watched the news, you probably saw it on the news last month. He turned 100. So I've covered a lot. And before we take a 10-minute break, I would like to pause to see if anybody has any questions. And don't just say no because you want to take a break. These sessions, I don't know what you did when you were with Mr. Pugh and Mrs. Watts, but we're going to be interactive. It's not just going to be me sitting here talking. So I know it's the first day. You might not have any questions. So questions so far. I'll stop talking to see who wants to unmute themselves. Mr. Ward, I want you to be an advocate for people who need to get their Social Security, because we don't want them to get bamboozled and signed up for something that they don't know about.
Don't feel bad. I got you. Cause I'm going to be trying it out like next month. After I hit 64, I'm going to try to do what I got to do. So this is a big insight and big help.
And you need to read the information. You know what they say? They say, I ain't gonna say who they is. They say, if you want to hide something from people, put it in writing, because people don't want to read.
They don't. I do.
All right. Anybody else? Miss Gutierrez. I always wanted to learn Spanish. I tried. I failed. I'm gonna try again though. Not this year, next year. Mi habla español poquito.
Oh, está bien. Se entendió. I understand what you said.
Oh, okay. Questions from you? And you're bilingual, so I mean, that is definitely an asset to an organization.
Yeah. No, I really don't have any questions, but I would like to know more about working from home. I know you mentioned that. So
Uh-oh, let me put this on my paper. So I won't forget, because working from home is good, but you got to be ready to work from home.
Yeah.
There are some things that you need to have in place, and there are some things that you need to know that have nothing to do with the job itself, right? So things like your computer and your workstation. At the beginning of the pandemic, my best friend, who is a medical coder, was sitting in a wood chair for 8 hours a day. And guess what happened? She fractured her little fanny, right? Yeah. Because you cannot sit in a wood chair all day and work, right? So I will put on my list. I'm pretty sure we'll have time. I will put on my list for us to talk about tips for success when working from home. Because again, there's a lot of organizations that don't have those tips. And these tips, I'm going to be brutally honest, these tips are from my years of working away from the healthcare organization and working with people who work for me who didn't know these things that I had to teach them. And it impacted their work because they didn't know these things. So I will figure out how to work it in. We'll spend about an hour talking about it, because there's a lot of things that you don't know that I believe you need to know, especially if it is your desire to work from home, or if you happen to work for a company that wants you to work from home. There's just some things you need to know.
Okay, thank you.
All right, so we are back from break. So we talked about the CMAA exam. So one item that I'm going to give you, and I will send it through Mr. Pugh, that I'm going to give you today is an outline for the exam. If you've ever heard this statement, start with the end in mind, I want you to have the exam outline so that as we begin to unpack all of these different topics, that you will have the outline to be able to visually look at and say, oh yeah, we talked about this, we talked about that. All right, so next up, I want to talk about our classroom time and how we're going to manage it every session. So at the beginning of each session, and you heard me correctly, each session, there will be a 30-minute quiz. And that quiz is going to be based on the previous day's material. So the quiz that you're going to have tomorrow is going to be about today. And so that is another reason why I am recording. The quizzes are going to be in an electronic format, and they will be given to you in a variety of electronic formats. And as we start to do them, you'll see what they look like. Sometimes the quiz will be a fun quiz. And so there is one tool that I'm going to be using, and I'm not sure if you all have heard of it before, but I want to give you an opportunity to know the name so that you can download the app. But one of the tools that I'm going to use is called Kahoot. Have you guys used Kahoot before? Some people are saying yes, some people are like, not really. So Kahoot is it's a tool that I use to play games because I don't think that learning should be boring. And Kahoot kind of has a little competitive edge to it, but you'll see it. We will actually do Kahoot tomorrow for our first quiz. So the quizzes will generally be multiple choice. And the reason for the multiple choice quizzes is because your national exam is multiple choice. So I want you to get used to taking multiple choice exams. There is a misconception about exams in that people believe, well, if I just memorize questions, I can pass the exam. You need to learn the content so that when you see the question on the screen, you can apply what you've learned to the question. And we'll continue to talk about that as we go along, but that's the only thing I'm going to say about that today. So you'll have a quiz every class session at the very beginning. That'll be the first 30 minutes. Then after that, I will lecture for an hour. Then we will have a 30-minute activity, and we will end each class session with what I like to call the Power Five. And the Power Five is where each of you will identify 5 things that you learned during that period. Now, let me let you in a little secret. It's always better to go first because whoever goes first gets theirs done. And then the person who goes last, now you got to try to figure out what am I going to say that's different than what somebody else already said. So that's just a tip. So this is going to be our daily schedule. And if I add up the minutes right, it should add up to 2 hours and 30 minutes, which is our classroom time. So Mr. Pugh mentioned you may or may not get out early. And again, our goal is that you can do the job and you can pass the exam. So if it takes us to 11:15 and we're done, we'll be done. But if it takes us up to 11:30, it'll be 11:30. If for some reason you have to log out because you have to go to the doctor, or you got to go and deal with one of your kids or your dog, cat, parent, spouse, partner, all that good stuff, no worries. Remember, I'm recording the sessions, and so you can go back and just if I were you, remember where you left off, and you can go back and review that part. Also, because you're having a quiz every day, you might want to just re-review anyway. All right, so questions on how we're going to be managing our time every day. And you will notice I drink a lot of hot tea, so I will be drinking tea throughout our class. Tea is like my happy place. It's when I'm most happiest in life, I think, when I'm drinking my tea. So I drink tea from about 9 a.m. to 5 p.m. every day. I have to cut myself off so I can go to bed at night. But tea and water is what I drink all day. All right, so you heard me mention that the work that the medical administrative assistant does is a part of the revenue cycle. And so as it relates to the revenue cycle, I want you to think about it as all of the processes that take us from a patient to payment, patient to payment. You got to have a patient in order to get a payment. And a lot of people have this misconception that healthcare organizations make a lot of money. And honestly, some are barely keeping the doors open. And I bet you can name a hospital or a clinic that you know without a shadow of a doubt barely keeps the doors open. Barely. Like every year you hear about them maybe gonna close. For example, Roseland Hospital is a hospital that's always in danger of closing. What's another example? Hospital always on the news. If you watch the news, you should watch the news so you can know what's going on.
They say Mercy is one also, right?
Yeah, and that's a problem because I used to work at Mercy too, 1995. If that hospital leaves, that's going to leave, and this has been on the news a lot, a healthcare desert in that area because people won't have a place to go. And healthcare is a basic need, and we should not have to drive, far away to get to the closest hospital. I have asthma. And so when I can't breathe, I need to be able to get to the hospital quickly and not have to drive, miles and miles and miles to get there. So Mercy is one. St. Bernard, Jackson Park, South Shore, and Trinity. Those 4 hospitals were supposed to be a part of this merger that was going to take place. And pandemic put a halt to that. And I think the agency that was going to, do the merger, I think they're done. They're like, we're out. So the problem is those 4 hospitals in particular have lots of needs, and when you need things, it costs money. X-ray equipment and just what we need to operate costs money, right? It's just like light bill. Hospital has to pay their light bill because you don't have lights, you don't have power, you can't, your equipment doesn't work, right? They need to have running water. They need to have heat, right? So there are bills that a healthcare organization has to pay. And what we charge an organization, charge a health insurance company is not what we get paid. And I'm going to say that again. What we charge a healthcare payer is not what we get paid. We could charge $100 for an office visit and only get paid $80. So if every payer is like that, when you add up that money, that's the revenue that the healthcare organization makes. Think of revenue like going to work every day. Go to work every day, you turn your time card in, on the computer or whatever, swipe in, and then 2 weeks later or a week later, you get paid. Well, healthcare revenue is directly tied to the services that are being provided, but we don't turn in our time card to the insurance company, our claim form, and we don't always get paid the next week. It could be a month, it could be 2 months before we get paid. But the hospital, the physician group, the nursing home, they still have bills that they have to pay. And their biggest bill are people, their employees. So they're paying their salary, they're paying for their health care, insurance benefits, on top of paying for the utilities. And if you look at the, let's just call it a checkbook for some healthcare organizations, how much they bring in and how much they pay out, they operating at a negative. It's like, back in the day, for those of you who are old enough, we used to balance our checkbook, like our money gets deposited into our account and then we have to write our bills. Well, oftentimes healthcare organizations are spending more than what they're getting in. So healthcare organizations, their goal is to have a healthy revenue cycle. And when I say healthy, I mean that everything is working as it should from the time the patient walks in the door to the time that we actually get paid. And again, it's not like a job where we turn in our claim form to the insurance company and then the next week we get paid. I'll use my business as an example. If I have medical billers providing services today, at the end of the month, I'm going to send a bill to the hospital. I'm not going to get paid for that bill the next day. But the people who are doing the work, what do they want? They want to get paid, right? So it's the same thing with healthcare. Our revenue cycle has to be strong so that it can remain healthy with resources so that when we got to make payroll, when we got to pay the light bill, all of that. Some healthcare organizations, and this is gonna blow your mind. Some healthcare organizations wind up having to do some things that we do in our personal life. For example, healthcare organizations need, let's just say, paper towel, right? For the bathroom, paper towel. And they order it from a vendor, and the vendor sends them an invoice. And the invoice says, you got 30 days to pay. So they start off, they're doing good, right? They're paying. And then something happens and they're looking at their books. I got to make payroll. I got to keep the lights on. And so they don't pay that particular vendor. And so the vendor, after a while, says, we no longer give you a line of credit. We require you to pay up front. So then they say, okay, we'll just go to another vendor to get our paper products, right? And they do the same thing from vendor to vendor. Now, you may be thinking, wow, hospitals, physician offices, they do that? Yeah, because their finances are just like ours. We got a lot going out and not enough coming in. So having a healthy revenue cycle starts with you, the medical administrative assistant, because you are typically the first point of contact that the patient has. So we are now going to talk about, hey, what happened to my slide is missing. Okay, that's really weird. 1 second. All right, well, I have some 5 things that are missing, so I'll just tell you what they are. So the revenue cycle is essentially how we go from patient to payment. And I'm going to say that again. The revenue cycle is how we go from patient to payment. And there are 10 steps that I want to tell you about. Of note, what you see listed here are only 5 of the steps. I got to figure out what happened to the other 5 because they are definitely missing. So step number 1, and you should be taking notes. Step number 1, and this is very, very, very important. Step number 1 is when the patient schedules an appointment. So step number 1 of the revenue cycle management process is the patient schedules an appointment. That's step number 1. All right. Scheduling the appointment today can be done in a paper format, or it could be done via a computer. And even today, actually, some organizations, you can go on a system and find an appointment time that works for your schedule without even talking to a live person. And I'll use myself as an example. I have a link on my email, on my website, that if someone wants to schedule an appointment with me, they click on this link, my schedule pops up, and they can select the time that works for them, a time that is available. So our patients, when they schedule appointments with us, they are occupying a spot that somebody else could offer. could occupy. So some organizations today have policies. And remember, I talked about policies as one of your areas. Some have a policy that says if you don't show up, we're going to charge you a fee. Now, why would an organization have a policy like that? If you don't show up, we're going to charge you a fee. We're going to charge you a no-show fee. Anybody with thoughts?
They don't want to lose revenue?
Yeah, because everybody that's in a slot, that is a person who we can potentially submit a claim to the insurance company for. So if we schedule them for an appointment and they don't show up, we can't bill for that service. And so some organizations have established no-show policies or cancellation policies because, number one, it teaches patients to respect our schedule and respect our time. But number two, that's a slot that somebody else could have. So for example, specialists are very difficult to get appointments with because there's a lot of people who need the specialist services, but there's not enough specialists providing the service. So for example, my father needed a cardiology appointment, and he scheduled the appointment. He was admitted to the hospital for a stroke and didn't show up at the appointment. They tried to charge him a no-show fee of $200. Now, why do you think that fee is that high? $200 no-show fee for the cardiologist.
Because that doctor is a specialist in his field and his time is money.
Yes, and if you tell me if I don't show up, I got to pay you $200. If I can't come, then guess what? I'm gonna call you and say I can't come. So now, of course, the office did have a policy that if something happened, we will reverse that fee. So we had to turn in the hospital paperwork to prove that he was actually in the hospital. So they got a no-show fee. They also have a cancellation fee if you cancel within less than 24 hours. Now, why a cancellation fee if you wait less than 24 hours to let them know that you can't make it?
They probably want to book another client, another patient.
Yeah, that's a slot that somebody else could have that person has now taken away. Okay, so again, because I know you guys are taking notes, the first 5 steps are not on the screen. I don't know what happened to them. But step number 1 in our revenue cycle is the patient scheduling process. All right, so we got the patient on the schedule. So then the next step is registration. And some organizations will call it um, pre-registration. And during the pre-registration or registration process, this is when we collect what is known as demographic information from the patient. Demographic information. So where do you live? You know, what's your address? All of that stuff. So when we schedule the appointment, we get a small amount of information. But once we go through the registration process, the patient intake process, that's when we learn more about our patient's financial situation. Now, I know you may be wondering or maybe saying, see, I knew healthcare was a business. Well, here's the deal. If we don't make money, we cannot keep the doors open because we got all those bills we have to pay. Oh, here's something else I want you to think about. You, as the MAA, you represent one of those people who is a bill that the organization has to pay for because they're paying your salary. So if the organization, and I've worked at clinics before where payday would come and we didn't get paid because they didn't have enough money to pay us because they weren't getting in that money. Because sometimes it could take 30, 60 days for us to get reimbursed for the services that were provided. So during step 2, which is the registration process, we're going to collect the patient's demographic information. We are also going to collect their insurance information. And when we collect their insurance information, one of the things that we're going to do is verify their insurance. Why do you think we want to verify their insurance? So they gave us their insurance card. So why do we want to verify their insurance? What do you think?
The insurance could be lapsed, or there may be an old something that they had that was old that they're not paying for now, or something like that, some of that nature.
Yeah, because food for thought. When you get a new insurance plan, they give you a card. They don't send you a cancellation card for you to carry around and say my insurance is canceled. So sometimes patients will present a card for an insurance, and then when we verify the insurance, we learn that they no longer have that insurance. It has been canceled. So at that point, we have to say to the patient that, first, do you have any other insurance that you want to provide us with? Or let them know that today's visit requires them to pay cash. Now, why do we don't want to say we'll bill you later for the service if they are a cash paying patient?
They might move out of their address.
Yeah. Or let's just be real. Let's just be real. Rent, doctor bill. Rent, doctor bill. Which one you gonna pay? You're gonna pay your rent, right? So if they are a cash paying patient and we send them a bill, chances are we may not get that money. Of note, there are some clinics where the patient is a cash paying patient, also known as self-pay, and we don't collect that money up front because the mission of that clinic is to help patients that don't have insurance. So for example, I'm going to name some names that you probably have heard of before. Howard Brown Health Center, Miles Square Health Center, Aunt Martha's, Alivio Medical Center, Family Christian Health Center, Access Family Health Centers, Friend and Family Health Center. Those are federally qualified healthcare centers, also known as FQHCs, and their mission is to help patients that don't have the means to pay for their insurance. So pay for their healthcare. So in the system, you'll see them listed as self-pay when it comes to their insurance type. Okay, so we're talking about revenue cycle. Step 1, scheduling. Step 2, registration. Registration, under registration, we have the demographic information, we have the insurance, getting the insurance information. And when we verify the patient's insurance, it will tell us if there is some money that they need to pay us at the time of visit. The money that they may have to pay us at the time of visit could be a co-payment, which is a small fixed amount. A co-payment, a small fixed amount. Co-payment, a small fixed amount. And with a co-payment, our insurance contract stipulates that we need to collect the co-payment at the time of service. And let me explain why. Anybody here has an insurance that has a copay?
Yes.
Okay. How much is your copay for an office visit?
Well, usually between $40 and $100.
Okay. So let's go with the lower end. Let's just say $20. So we bill you for your copay. Instead of collecting it at the front of the visit, number one, we missed out on that revenue. Number two, chances are we are now going to have to send you a statement for that $20. And when we send you a statement, that statement is printed on a piece of paper. So now we got to buy paper. And the words on the paper are the result of an ink cartridge that we use. So we got a piece of paper, we got to pay for ink, and then we have to fold the statement up and put it in an envelope. And then, what's this? Stamp. We got to put a stamp on it. So now we've spent $10 trying to collect $20. Does that make sense? No, right? So we want to collect the copay at the time of service because number one, our contract with the insurance company says that we will collect it at the time of service. And that's before the visit, not after the visit. Want to know why? After the visit, we got to remember to catch you to get the money. And some patients will say, oh, I left my wallet in the car. I'll be back. And guess what happened? They don't come back. I worked for a foot doctor, a podiatrist, downtown Chicago. And people would come to the office, problems with their toes. And if you ever had toe pain, you know that it hurt. So these patients would give us the wrong information during the registration process. And we would be, trying to find them, and we get that yellow sticker, or we get that, return sender not known, or, person not known. Or I distinctly remember a situation where the patient said they had some toe problems. We got them in. The doctor clipped the toes and did whatever he needed to do, and the patient has some relief. Patient owed us money, and the patient said, "Oh, you know what? I left my wallet in the car. I'll be back." Patient did not come back, and the information that we got from that patient was the wrong information. So when we have a patient that we register, and we're still talking about step 2 of the revenue cycle, we have to verify that that information is correct each and every visit. That they still live at the same place. And we're going to talk about that in future sessions, as well as re-verify that insurance each and every visit, because things can, if you don't know this by now, you should know something can change day to day, right? Nobody ever thought in our lifetime that people would storm the Capitol building, but it happened. Nobody thought in our lifetime that we would have this pandemic, right? That would force us to be stuck in our homes and stuck looking at people all day and night that we normally only see a couple of hours a day, right? So you would have never imagined that happened. And so things change from day to day. So we have to get that information at the time of service, each and every visit. So co-payment, small fixed amount. The patient could also have what is known as co-insurance. The difference between co-payment and co-insurance is that co-insurance is a percentage that is after the insurance company pays. So for example, my insurance that I have, they pay 90% and I pay 10%. That's my co-insurance. Some organizations have taken it a step further as it relates to co-insurance. And I'll give you an example. My husband needed to have an x-ray, and he got scheduled for his x-ray, got the date set. They called him and said, "We verified your insurance, and your insurance requires that you pay a portion of this x-ray, which is $100. And they said, that's not a co-pay, that's co-insurance. That was his 10% that he needed to pay. He didn't have a co-pay for that service, but he had co-insurance. And when they called him, they said, we require payment at the time of service, and we want to know how you will make that payment. Visa, MasterCard, whatever. And they typed that into the system. And then when he showed up for the x-ray, before he got the x-ray, they said, we'll take that $100 Visa payment now, before the services are rendered. Why? Because before the services are rendered is the best time to get the payment, because after, they gone. Got the x-ray, got what I needed, and they go on with life. So 2 terms you just learned about as it relates to the registration process: copay, co-insurance. Copay, small fixed amount. Co-insurance is a percentage. Now, I gave you an example of 90%, 10%. Somebody's insurance could be, they pay 40 and their insurance company pays 60. every patient's plan is different. And so you don't assume because somebody has Blue Cross Blue Shield of Illinois that everybody that has Blue Cross Blue Shield is the same. And we're going to break apart the different payers in the coming days, but every company is not the same. So that was step 2. Step 3. Step 3 is the patient visit. The patient goes into the exam room. The provider sees the patient. Now, I use the word provider. I use the word provider because not all patients are seen by a physician. It could be a nurse practitioner. It can be a physician assistant. So we use the term provider because today there are more billable providers out there. Oh, the other thing I should tell you is there's a lot of things that I'm going to be covering that you're not going to find in a book because real world isn't textbook. So that's another reason why I'm recording, because I want you to be able to go back and look at that information, listen to it at a later date. And I have my camera on so you can see me, you can see the information, and hopefully it's more personable and you feel like we're in a classroom, even though we're not in a classroom because we can't be because of COVID. So during the patient visit, the provider is going to document the services that were rendered. The typical type of documentation is called a SOAP note, S-O-A-P, S-O-A-P. And we'll talk a little bit more about those. And what we're doing today is introducing you to the revenue cycle. And then we will take one area at a time and just expand on it more than what I'm doing today. Okay, so after the patient visit, the very next step, so now we're talking about step number 4, is the coding process, medical coding. So that's step 4. Medical coding involves taking the words, turning them into numbers. And I'll say that again. Medical coding is where we take the words, diabetes, and we turn it into a number. We take the word or the service, office visit, and we turn it into a number. That's medical coding. After the services have been coded, step number 5 is the charge entry process. So the charge entry process is literally where we're putting the codes into our, and let's just talk about a physician office right now, our practice management system, charge entry. So the diagnoses, the procedures, all of those are inputted into the system. Oh, something else I should know. We got to pull the patient account up first. So all the information that we gathered in the previous steps is now what's on our, that was in our charge entry screen. So if the person at the front desk registered the patient, we pull that patient back up and we enter the charges in. So that's step 5. Step 6, now we are looking at the diagram on the on the screen. Step number 6 is the claim scrubbing process. So a claim scrubber, so step 5 was charge entry. Step 5 is charge entry. So step number 6, claims scrubber. And who knows what a washing machine is? Everybody, right? Because we just one of those adult things you got to do is wash your clothes. So a claim scrubber is like a washing machine. And what the claim scrubber does is scrub the information that was inputted and puts it onto an electronic claim form. So step 6, the scrubber, it scrubs the claim, all of that stuff that was put in beforehand, and it's looking for errors. Here is one type. We registered the patient as date of birth, April 1st, 2020. April 1st, 2020. If somebody was born April 1st, 2020, they are almost 1 year old, right? The claim scrubber identifies that the procedure code that we use today says that the patient is 6 years old. And so the claim scrubber says error, and it kicks it back to us so that we can correct the error before it moves forward. That's one example. Another example could be we register the patient as a female, but the code that we use says for a male patient. So we register the patient as a female, but the service that was done today was a vasectomy. So the system is like, hey, something's wrong. Okay, so that's what the claim scrubber does. It scrubs that claim with a goal, just like your washing machine, of having a clean claim, free of errors. Some organizations have, with their claim scrubber, they have a clearinghouse that they use that's helping to scrub the claim. And it's also looking for errors. It's looking for, we typed in a certain zip code and that zip code is invalid. And so again, it's trying to catch these errors on the front end before we get to the next step. And the next step is that we submit the claim, claims submission. All right, so the claim is submitted, which is step 7, and it's submitted electronically. We don't do a lot of paper claims anymore. It's submitted electronically. And now we go to the next step, is we get a response from the insurance company. And the insurance company says, yes, we're going to pay the claim. No, we're not going to pay the claim. Or maybe. Yes, no, maybe. If the answer is yes, they're going to send us money, either electronically or a paper check. We like electronic. Why? Because it's like a direct deposit. So they say yes, they pay us. And then when that payment comes in, now we're at step number 9, which is the payment posting process. We take the payment that we received for Mr. Smith's a date of service of January 19th, 2021, and we apply it to that date of service to balance out his account. Step 10, claim appeal. That's when they said no. And we believe they should have said yes. And so we send them a letter and perhaps documentation that explains why we believe that we should get paid today. Those are the 10 steps. As it relates to step 8, I said the payer response could be yes, no, maybe. Yes, they pay us. No, they don't pay us. And we can do step 10, which is appeal the claim. But sometimes they say maybe. And maybe could be that they need more information from us, or they need more information from the patient. An example of needing more information from the patient is patient was seen in the doctor's office today for a sprained ankle. Anytime the insurance company sees some type of injury, the first thing that they think about is, do we got to pay this bill? Is somebody else responsible for paying this bill? So they may suspend the claim in the air while they're waiting for information from the patient. And usually it's a questionnaire. And the questionnaire is, how did you hurt your ankle? Were you at work? Because if you were at work, we're not paying for that. That's workers' compensation. You were walking down the street of Chicago and there was a hole and you tripped. Oh, we're not paying that. City of Chicago should pay your doctor bill. So they send the patient that questionnaire because they're trying to figure out, is there a third party that's liable for the claim and not us? So that could be a situation where they say, maybe we'll pay the claim because they're waiting for information from the patient. And they'll generally let us know that they are. And then we need to contact the patient to get the patient to send that information in. Could be they need information from us. Maybe they say, we want to see the office note for today. Because generally, when we send the claim in, we're not sending any medical record documentation. We're just sending in the claim form. And so they may want to see the documentation because they want us to prove that we provided the service or they're questioning the service, just to name a few. So 10 steps. Step number 1, scheduling the appointment. Step number 2, registration. Step 3 is the patient visit. Step 4, that's the medical coding process. Step 5, charge entry. Step 6, scrubber. 7, the claim is clean, so we send it out. 8, the payer responds to us. 9, we post the payment. And 10, if they told us no, we can appeal the claim. This is the healthcare revenue cycle. Every organization is going to have different names for it. However, the processes are always going to essentially be the same. There are different forms and tools that we use to carry out this process. And over the next couple of sessions, I will show you some of those tools. Now it's time for Power 5. And remember, Power 5, 5 things that you learned today, and you cannot duplicate what somebody else said. And Nancy said, you're not going to get me. I'm going first. So I'm going to turn my microphone on mute so we can hear your Power 5.
So there's 10 steps to a revenue cycle. Should I say them or no?
Go ahead, because you know what? The more you hear something, you'll remember it.
Right. Okay. So the first one is patient scheduling. The second is patient registration. The third one is patient visit. The fourth one is medical coding process. The fifth is charge entries. The sixth is claim scrubber. 7 is claim submission. 8, payer response. 10, payment posting. And number 10 is claim appeal. And so yeah, there's a lot of information about each of those. I learned for example, the second step of the revenue cycle. It's the patient registration, which involves co-payment and co-insurance. The co-payment belongs to an amount that the patient gives, and the co-insurance payment, it's a percentage that the insurance gives. For the patient visits, I put down patient goes to the room and provider sees the patient, which provider is used as it could be a provider. What was it called? The registration nurse that are providers now?
A nurse practitioner.
Oh, nurse practitioner. That's the correct term. Or it could be a doctor that sees the patient. What else? Oh, and the medical coding process is taking the words and turning them to numbers. And my favorite one is the claim scrubber, which they use like is it a machine or is it an app?
It's a
An
computer
application.
program.
It's a computer program that is used to find errors so the coders can correct them. And I think that's the 5, right?
That's good. Good, good. Thank you very much
Awesome.
being brave and going first. And Mr. Ward is coming up on your heels. He turned his microphone off. He's like, I'm getting in because I don't want to forget.
That's right. Well, one, how hard it is for insurance for hospitals to really stay open. You never get that process in. You just think, you go to a hospital, you pay your money, and everything's okay. So I learned about that. And like she said, one of the things I didn't know about the insurance, about the insurance percentage. I didn't know I know about copay, but I didn't know about the other part, about the insurance percentage. Yeah, well, did I have to do 5 or huh?
Was that 5?
Can I just do 2 for right now?
Okay, I'm gonna let you slide today.
Oh, okay. Thank you.
Thank you so much. Next up.
You're welcome.
It's only one person left. Everybody else skipped out of here. They didn't want to do that Power 5. Well, some people had places to go. I know they told me in the chat. Miss Coleman?
Didn't they get it all?
No, I've been talking for 2 hours. They didn't get it all.
Can I say I learned more about my classmates or no?
No. You got to know something you learned.
I'm guessing invoices and copays.
Invoices.
And how insurance is set up. And revenue, and I didn't even really know that. Hey, if the hospital's not making enough. No one's getting paid. So that's news to me. um, Also about you know, them also being credits.
Mm-hmm.
Hospitals, if you don't pay this, and I've never thought of hospitals not being able to pay their bills because they just charge so much for so little things.
And
um,
so
so
here's,
yeah.
I'm glad you mentioned that, because what we charge, and when we get to that point in the class, whatever point that is, we'll talk about how what we charge is not what we get paid. Think of it like when you work, you got your gross and you got your net. What you bring home, it's kind of like that. We may charge $100 for an office visit, but based on our contract with the insurance company, we only get $80 or $70. So, but we still got to make payroll. We still have to pay for our supplies and our equipment and everything that goes into providing that service. And so, the business of medicine is very, very important. And we have to make sure that we keep our revenue cycle healthy so that the organization can keep its doors open. Well, I hope you learned something. How was today for you guys?
It was really nice.
Good. And I have a question.
Uh-huh.
Now, uh, with that being said, how was Stroger's, which was Cook County, now how was that process work as far as the payment and keeping the doors open and all that? Because back in the day, I was born in Cook County. And I know my parents didn't have a lot of money. So how does that process work?
So number one, they're owned by the county, so taxes, and they receive federal funding. But honestly, people look at that organization, they think it's a well-oiled machine, but they have oftentimes have claims or services that they've rendered that have not been coded. And the patient was seen 6 months ago because they're behind. So one of the things that my business does is that we do backlog work. So if the organization staff is behind and they need an extra pair of hands to come in and jump in there and help, that's one of the things that we do. And it could be short term or it could be long term. But if the service isn't coded, you can't generate the claim, which means the claim is literally sitting in the system until somebody looks at the medical record documentation, assigns the diagnoses and the procedure codes, and puts them into the system so that that process can continue. All right, well, I have some follow-up items that I will send to Mr. Pugh this afternoon to get to you. And just so that you know what they are. One, I'm going to send you a outline for the exam, a content outline. Number two, I'm going to send you the link for where I'll upload the recordings daily, so that if for some reason, well, I know you got to be here because Mr. Pugh got rules you got to follow, but if for some reason you're absent or you want to, something happened and you had to leave early, you can go back and listen to the recordings because we got that quiz every day. And don't forget to download Kahoot, because that will be one of the tools that we will use for quizzes. All right, questions before I kick all of you out? Besides Mr. Pugh and Miss Watts.
Could you spell out Kahoot?
Yes, I'll
I
actually.
just put it in the chat.
Okay.
Oh,
Thank you,
okay.
Mr. Pugh. So I will see you all in the morning.